Well, we're having our mini health fair at Community Links. This is Heart Healthy Month, and we're showing all our services and doing a mini health fair for the community, checking blood pressure, body mass index, and talking about nutrition and all the services we offer. We do also, not related to heart, but we've started offering a service this past year, a mobile PET CT service. We've been in service for over a year. We started in January of 2014, and these primarily are for cancer patients. The oncologists, the pulmonologists, and surgeons will order these PET CTs, and we do them on Wednesday.
This is our annual heart run that is coming up February the 28th. That's going to be the last Saturday of the month. And it is to benefit our cardiac rehab here at Coosa Valley Medical Center. And the registration starts at 8:30 a.m. and the run will start at 9 a.m. We're doing a 5K and a 1 mile fun run, so it's for family, friends, whoever you want to bring. This year we're also welcoming animals, so for $5 you can bring your four-legged friend and get a bandana that's going to go around the neck of your animals, bring them all out. So it's a family event, and it's going to go for a good cause, just to kind of raise heart awareness for the community about heart health and everything that we can do as a community to kind of come together and enjoy this heart health event.
Shannon, give me a number that folks can call for more information.
Okay, they can call 256-401-4070. That's Nicole Bolger, and she's more than willing to take registration over the phone. They can also visit our website at www.cvhealth.net and register and get registration information there as well.
Hey, great job. Hey, if you don't want to walk or run, but you want to come just hang out, have a fun day, get you the cutest t-shirt ever, then you can do that too. So we'll be rocking kind of like we were in here today. We'll be rocking out, and we'll have a hospitality tent and those sort of things. So we'd love to have you out just to celebrate that day with us. A couple of other things real quick. This is a fabulous deal. I don't know if you've seen it yet, if you saw it in the paper this week. Show your heart you love it. That was what today was all about. And the way you can do that, our Fitness and Wellness Center, and you should have one in your bag, is celebrating Heart Month by get one membership. If you buy a membership, someone gets one free. Guys, you cannot beat that deal. So I would encourage you guys to, if you're thinking about, hey, I want to go down to the gym, even if you just want to get on the walking track, there's all kind of things. I mean, I go in there some days and I think, oh, I really fit. There's just people in there on the treadmill and they're walking. If I go in there late at night, I'm thinking, oh, this is over my head. That's when the big guys are in there really doing that big stuff, and I just get on the treadmill and kind of watch them and get back on the bicycle. So you can do those sort of things. So we encourage you. It'd be it's a husband and wife, a friend to friend, whatever. That would be a great way to get signed up and kick off this Heart Month by getting involved in our Fitness and Wellness Center. So that's in your bag, so you can take that home and give those guys a call. And how many of you were here the day that Mandy Raines came about a year ago and we exercised? I was sitting up here in this chair, and she was calling it Senior Fit or something like that, and I was gasping for breath and thinking, oh my. But this month, Mandy is bringing back what they call Senior Fit Exercise 101, and you should have got this as well. This kicks off Wednesday, February the 11th at 10 o'clock there at the gym. So if you're interested, give her a call and get signed up. And she tells me it's designed for us people that our joints hurt a little bit and we don't move as fast, and we can't do all that big muscle fabulous stuff, but she said this will fit us perfect and we'll have a great time. So there is no excuse for any of us not to get on the right track and rock our heart this year with all these great deals. So again, Coosa Valley Medical Center is glad to be here. We're glad to get Our Community Links kick back off for the springtime, and we look forward to being here every month till summer, and then we have to take a vacation. So with that, I'm going to have Andy Gill, who leads us in our cardiac care at Coosa Valley, to come and introduce Leah, and Leah's going to bring it home for us today.
Thank you, Vanessa. First, let me say on this 5K, if you've got a cat, please don't bring it, because my 100-something pound lab will drag me. I won't run, I'll be drugged. So please don't bring a cat. First, let me say it's an honor and a privilege to be able to introduce Leah Ashworth to you today. I've known Leah for a number of years. Leah loves Stanford University, I guess, because she's graduated from there 3 times. She's an associate fellow with the American College of Cardiology. She has 2 boys, 21 and 17, and her oldest goes to Auburn, so that's a good thing too. She's been in cardiology field for 25 plus years. She started when she was 10, and most of you may know her. If you know her, she worked with Dr. Michael McKinney for years, and you might have seen her in the office here on Tuesdays or Thursdays. She's now with the Heart South group. So without anything else, I'll let Leah take it.
Thank you, guys. Now, I have 2 children, 21 and 17. Whenever I have any technical problems, they help me. So if I look nervous, that's because they're not here. So at 50, I tend to be a techno-dino. But I did work for Dr. Mike McKinney for many years as his nurse practitioner, and he relocated to Kentucky. And I've recently been working with Heart South, which was right next door, Dr. John McBrayer, Cliff Vance, Dr. Chapman, and Manish Goyal. I will say, after working down here for a long period of time, you cannot get a bad cardiologist in the city of Sylacauga because just is not one. I've worked in the business professionally with all of them for 25 or 30 years, and they're all excellent. So the services that are provided down here over the last couple of years especially have just exploded. So that's been a good thing, I think, for the community, and we were always very honored to be a part of that. Today, I was going to talk, when they asked me to come talk, and it's February Heart Month, I think what I'm going to do is just remind you of a few things. If you're my patient, you may not go to sleep because you probably heard some of this in the office, okay? But the rest of you, if you haven't heard it, maybe it'll drive a few things home. The first thing I wanted to ask you is, do any of you guys know what the #1 common cause of death each year in the U.S.? Do you think it's cancer or heart disease? Very good. Y'all are good. Basically, heart disease kills more women. We're all worried about cancer, but breast cancer and abdominal cancer, heart disease kills more than any of those combined. The same thing for men, prostate cancer and lung cancer. Heart disease kills more than those 2 combined. Really, heart disease kills more people than all cancers combined. So about 100,000. These are yearly causes of death, so heart disease, cancer, stroke, and then everything else falls off sharply after that. So basically, prevention is huge. What I do and what many nurse practitioners do in my type of role is primary prevention is trying to prevent heart disease from ever starting. Many of us after 60, 65, we're going to have a touch of vascular disease. That's kind of the way God made us. So a lot of times I'll meet somebody after they've had a heart attack. They didn't even know they had heart disease. And at that point in time, I pick up secondary prevention, which is just as important. Because if you have a heart attack, and let's say you don't ever do the lifestyle changes, you know, your quantity and your quality of life is not going to be quite what you probably want it to be. So whether you're doing primary prevention and you've never had vascular disease, or whether you're doing secondary prevention and protecting yourself after an event, whether it's a stroke or a heart attack, that's just as important. Uh-oh. No, see, she told me not to get nervous. I'm going to get nervous. There has been some good news. I think, again, I've done nothing but heart work for 25 plus years. And so sometimes when you hear me talk, there's a little bit of a seasoned thing into what I've seen throughout the years. I think I know that the death rate from heart disease over the last 10 to 20 years has declined, and it's declined pretty well. I think all of that is technological advancements, which have really grown. Think about it, 20 years ago, we didn't even have heart stents. We had angioplasty balloons. 1 in 3 of those closed down the artery. Nowadays with stents, we don't really have that type of problem. So we've really come a long way. So heart deaths have really declined over the last 10 to 20 years. Unfortunately, in the state of Alabama, we rank usually 50th out of 50, with heart disease being our #1 cause of death, and stroke, we rank 50th out of 50th. So the good news is death rate is declining. The bad news is in Alabama, we need to do a better job. And I think we all like our fried food. And you'll notice in the cardiovascular mortality is that men have really benefited. Men is the blue line, and they have really benefited over advancements in cardiac care. Women, we have not had the same. We've kind of held more even to that. Also, the last 10 or 20 years, there's been more education that women's heart symptoms tend to be somewhat similar than men. And especially if you're in the crowd and you are a lady patient of mine, men will come in and many times will give you the classic, there's an elephant sitting on my chest. Women come in and they're quite a bit more vague, I'm just not feeling quite as well. I've got a little twinge in the middle of my back, and you really have to sort through it. What is their clinical story? Okay, that's one thing. What are their risk factors, which might be quite remarkable. But women just don't seem to present quite like a man does. And so we really do need to be careful of that. Well, I have a moment, I'll tell you that 1 in 3 of us have no cardiac symptoms before you have a heart event. So that's 30% of us don't have any symptoms at all. 2 out of 3 of us have something between the classic, there's an elephant on my chest, to vague symptoms. I think I've got a toothache. So you just have to if you guys are seasoned, y'all know your bodies, many of you are caring about education. So if something comes on you that you're not clear about, but you think it is important, always talk to you about your health provider. Go in and see them. Something's changing on me. I'm not really sure what this is, and let them help you sort it out. I think you guys are a good crew to tell that. This pretty much is the same type thing. And like I said, I think technological advancements, both medicine and in the operative room, have led to that. Usually as a provider, what we do is listen to the clinical story of someone. So that's the #1 thing we do. Then the next thing we do is assess their risk factors. If this is a 22-year-old coming to see me with chest pain and nothing else wrong with them, I'm thinking they lifted too much weight in the gym. Versus if this is a 65-year-old person coming to me, and let's say they have cholesterol problems. I think I'm going to come back to that slide if y'all don't mind. If they have cholesterol problems, or if I ask them, do you have a family history of heart disease? A lot of people will say yes, and then you talk to them and it's not quite vascular disease. Probably we don't know really sudden death prior to the 50s. We always kind of consider as heart problems, but we know so much more nowadays. But when you're really looking for this, you're looking for anybody in your family that's had a true heart attack, anybody in your family that's had a stent, a balloon, anybody in your family that's had bypass surgery. Those are vascular disease. I usually will add stroke too, because stroke is a vascular event, or carotid problems. It's all the same disease, just in a different place. The next thing you want to know is this like your father, or is it a great-great uncle? The closer they are to you, the higher your risk. The earlier that it comes on you also, like if it was somebody that was a first generation, the earlier that it happened, if it happened prior to 65 for a woman and prior to 55 for a male, you're more at risk. After those, it's usually type of aging that comes on you. So if your father died of a heart attack at 50, what does that mean for you? That means you need to be very, very careful. If your mother died prior to 65 of hearts, what does that mean for you? You need to be very, very careful. It's just part of the whole assessment of your risk factor. The younger this has kind of been what I've been saying, is the younger you are, the more you're at risk. Smoking. I know there's nobody in here that smokes. Y'all are all too handsome and pretty, but smoking, you know, after doing this a long period of time, if you're 80 and you come to me smoking, I'm not going to make you quit. If you're 40 and you come to me smoking, I'm going to make you quit. But it is definitely a risk factor. And interestingly enough, after doing this a long time, sometimes it doesn't just hit the heart if you smoke. Smokers are 8 times more likely to have blocks in the neck and in the legs, and those leg blocks can be extremely painful. You can get wounds and sores from those. So not only does it affect the heart, it tends to affect the whole vascular tree. So if you smoke, I would suggest trying to quit that. There's lots of things nowadays that we can give you to help. If you don't smoke too much, generally I'll use the patches and wean a person down. If a person smokes a whole lot, I usually use a medicine like Chantix, and I'll talk to them about that. You kind of have to weigh the risk and the benefit of all of that. But I would say definitely if you're past 45 or 50 with family disease of heart attacks and you smoke, you really need to quit. Smoking increases the blood pressure, gives you some poisons and chemicals that you probably don't really want. And those are some scare tactics on the bottom there. There's a lot of government resources too. If you know someone that smokes, the Alabama Department of Health, they give a lot of free samples away. The federal government does as well. So I would tell you that if you know someone or you yourself smokes, to research that. And these are some things that you probably know. But basically, you have a quick decrease in the risk of heart attack because nicotine causes a clamp down effect of your vasculature. So basically, as soon as you quit, you decrease your risk. Smell and taste improve, and your cough disappears. You don't sound like an old truck starting up in the morning. So the other risk is hypertension. When I first got out of school, high blood pressure was 160/90 or greater. Throughout the years, what we've learned is those numbers, if we could drive them a little bit lower, it prevents wear and tear on your body pipes from your head to your toe. So basically nowadays it's 140/80 or below. That's kind of the goal you're trying to get to. It doesn't matter if you've got to take 3 medicines to get to 140/80 or below. Your outcomes will be the same as mine on no medicine with good blood pressure. So you want to treat it if you've got it. High blood pressure is an aging disease. 1 out of 2 of us will have it at 50. 3 out of 4 of us will have it at 75. So there's something that does come on with aging and hypertension. But also, if you get too much salt in your diet, smoking again, those type things can also increase your blood pressure. Many times when you come to the doctor, you've kind of heard of that white coat syndrome, and everybody freaks out because the blood pressure's up at the doctor's office. Most of us that do this all the time are really looking for what you bring in. What did you get at home? When you're at home in your normal environment, are you mostly 120/80? And when you come to the doctor, you're 150/90 after you've had to get up, get ready, park in the parking deck, or, things like that. So we're not really looking for that one. But also, if you come to the doctor's office with a couple of high readings and you've not checked it at home, most of us are going to start you on something, and then you've got to prove yourself. You've got to monitor it and bring it back in and say, hey, look, can you take me off that medicine? It's really good. Because we know the outcomes. The outcomes are you need to be below 140/80 or you're not going to do as well. So document it at home. Everybody's going to have occasional bad day. Everybody's going to occasionally have a salt overload, and it's going to be bad. But if most of your numbers are good, we're happy with that. Also, before your medicines and things in the morning, we don't particularly take those numbers as much. God allows us to secrete some chemicals that wake us up. And so the blood pressure tends to rise in the morning. So usually we kind of say, you know, get up, get your medicine, get your breakfast, take your blood pressure about 2 hours after your medicine. And that kind of tells us if the treatment's working or not. If your blood pressure 2 hours after your blood pressure medicine is still uncontrolled, we need to do a better job. So this to kind of let you know that. Salt, the American diet is loaded in salt. So basically you try to eat fresh food, flavor it with a minimal amount of salt. You're trying to get about 2,000 milligrams a day. A can of soup has 500 milligrams. So, you know, just start to be kind of savvy. I usually tell my patients they don't have to be a purist about it, but once you start really looking at it, you're gonna be a little bit amazed. And I think we as Americans are kind of killing ourselves with salt. We don't really realize it, to be honest. I tell my patients if they have bad heart disease, they really can't eat fast food. There's nothing out there, fast food, that you can truthfully eat without it having 2,000 milligrams of sodium and a burger. So you really just be savvy. If you truly do have risk factors or you have a heart disease, fast food is an occasional treat, but not often. Not often. Let's see. Cholesterol, I think, was one thing I mentioned. Don't drink wine and alcohol into excess. There's a number of reasons for this. The heart itself does not like wine in excess, not the vasculature, but the heart muscle. Actually, the heart muscle in a person that drinks too much tends to get weak, and instead of beating strongly, will beat like this. Alcohol socially is fine. Actually, in some ways, we think that it helps the good cholesterol, but definitely alcohol in excess is not good for the heart. Anybody that has diabetes or kidney disease, I put these hand in hand. Kidney disease is if you go see a kidney doctor and you're close to kidney failure and they talk to you about dialysis. Anybody that has diabetes or kidney disease is very, very likely to have heart disease. When those people hit the emergency room talking about chest pain, everybody wakes up and pays attention because we know that their risk is so high. It pretty much, we consider it heart disease until we've proved it otherwise. So if you yourself have diabetes or you yourself have kidney disease, you have to be even more careful than the next person. A lot of my folks will come to me and they'll say, okay, Leah, I've had a heart attack now. I've got diabetes, I've got high blood pressure, I've got high cholesterol. I quit smoking, and now I need to know what diet to do. If you're diabetic, don't listen to everybody else's diet. If you're diabetic, control your blood sugar. That's your number one ability to slow the disease, okay? Heart disease and diabetes are closely linked. So just control your sugar. Don't listen to somebody else that tells you, oh, you can never have a steak again. You've had a heart attack. Listen to your provider who's going to say, I don't really care about the steak so much, but you can't have that cake 3 times a day. So control your diabetes. Basically, people that are on injectable insulin tend to be a little bit more at risk. If you have obesity and diabetes in your family, you really want to try to battle obesity. Y'all don't really want to see that one. And cholesterol. On your sheet, I have used the cholesterol numbers that come out of the hospital. So if these are just a little bit different, I've given you the ones that most of you with your providers down here are a little bit more used to. Total cholesterol, you want to be below 200. We've gotten a little bit more sophisticated in that. I remember in the days when, you were happy with just that number. Nowadays, though, there's a lot of other components we look for. We look for something called LDL, which is your bad cholesterol. That tends to lay up in your arteries and make heart blocks. You really want that below 100. per the things that we're using down here. If you have heart disease, you want it below 70. It's usually affected with fats. So if you have a high LDL and your doctor's like, high LDL, what you want to do is cut down fried food, cut down red meat. It tends to be affected with fat. HDL is your good cholesterol. God made us this fascinating redundant system that's just been a delight to work with. But HDL is the good cholesterol. You want that number high because it's like a pump. It gets the bad cholesterol out. So if the number's high, you may not even need cholesterol drugs, to be honest. But the good cholesterol, you can't really give a medicine to make it better. The things that affect that are stopping smoking, little regular exercise. Sometimes a touch of red wine tends to improve it. Also, omega-3, fish oil. I don't push fish oil all the time because a lot of my patients are intolerant to it. They tend to say, I'm burping fish all day, Leah. But any kind of an omega-3, like a flaxseed oil, a lot of times nowadays you can go to the pharmacy and they'll tell you, hey, this is mixed really well. This is a good omega-3 oil. So if your doctor comes to you and says, or your provider comes to you and says, listen, your good cholesterol is really bad. What you want to do then is pick up some regular exercise, quit smoking, pick up a bottle of omega-3. If you drink just a little, switch to red wine. If you do not, the Welch's dark grape juice, you can have just a little bit of that. It's something in the skins of the grapes that we think, the tannin that's doing that. So that's kind of an ongoing kind of thing, and I think you'll hear more about that. But definitely I think we've learned a lot about good cholesterol. When I see somebody that comes to see me with chest pain, maybe a smoking history, a little blood pressure problems, and a good cholesterol of like 20. Remember, it's supposed to be 40 or greater. That person has a high risk of having heart disease. It's showing up genetically for them. So just so you know that. So if your doctor's saying, that's too low, you need to kind of pay attention to that. Triglycerides are also associated with sugar. It says fats up there, but they're also associated with sugar. So if I have somebody with very high triglycerides, I tend to talk to them about eating like a diabetic. So those are pretty much the risks. So when you come see us, the way that we work this out is we listen to your clinical story. You having chest pain? You're not? What are your risk factors? We generally go through all of this with you. And then we may do some studies. We may do an EKG, which gives us an immediate information. We may do a stress test. Stress test gives you an indication of heart blocks. That's what you're looking for when you do a stress test. That's about 80% accurate, 0 risk. An ultrasound of your heart may be gotten. That kind of shows if the heart beats well and the valves beat well. So those are 2 tests that cardiologists use routinely. Those are probably our biggest tests. We've got a few more tricks up our sleeve, but those are usually the biggest. I also wanted to say something to you guys about always discuss issues with your provider. They know your situation best, and in doing this a long time, what I find is people will come to me and they've talked to several of their friends, and so they've taken themselves off blood thinners because their friends are worried about something. And that's kind of the worst thing you can do, because usually if somebody's put you on blood thinner, you really need to be on blood thinner. So I find people all the time, well, I took myself off my thyroid medicine because I thought it was making me fat. Well, the 2 medicines that you can get the most in trouble with are thyroid medicines and blood thinners. So if you ever feel like the treatment isn't working or you're not tolerating the medicine, always come tell your provider, or it's too expensive. All of us nowadays generally talk to people pretty quickly and readily about that, because I think we may have to go to all these meetings and all this stuff about learning all this stuff. Nowadays that's 24 hours about that. But if you can't take the treatment, it's not doing you any good, so always talk to us about it. And I'll close because y'all will enjoy this. I had a lady call me the other day, and she said, Liam, my leg is hurting. And I said, okay. And she said, can I take my mother's Coumadin? And I said, well, First of all, I don't want you to take anybody's Coumadin. Second of all, I'm not going to give you Coumadin for your leg hurting you. And then she talked to me about, and I've been bleeding a lot. And I'm like, oh yeah, okay, this just gets worse. So I think, though, I've seen so many people be hurt by that. And I guess I just want to take a period of time to say, yes, I want you to do all these things. Your providers, whoever they are, again, you can't get a bad cardiologist down here. They spend a lot of time and energy in your specific thing. It's not something that your friend or your neighbor or your family member are going to have the same specific thing you do. So talk to them about it. So I think that's also something that helps promote good health. So, but I think you guys do all the things right. Y'all are educating yourself, and you've got a great support system down here. So thank you.